Now I'm going to move immediately to the second panel because I have them ready and I really appreciate their time. Both of the two I'm going to invite now. I'm going to move to the health panel or the health perspective on this Black Lives Matter. And I'm very, very honored to have two distinguished academics and professionals with me. They are both doctors, they're consultant and everything, but they're really distinguished by all standards, academically, professionally, award, everything. And although I originally said to the people in the social media, I will be as flexible as possible with both of them, I am going to use the way the South African user Nelson Mandela introduced. I gave them originally the green light for a positive discrimination because they are serving life. So I said to them, come whenever you come. But they came earlier than I expected because they're so dedicated. And they, so I would go straight to start by Farida. Shall I start by you, Farida? Farida, are you okay to go first?
I'm okay.
Now, let me introduce you, Farida. There's so much I can say about you, but I can't say it all. All these people, as I said earlier, they are on the website, their CVs and so on. Farida, I think there's many things to say about her, many things. She worked very hard. She have fought for many for ethnic minority. And I think one of the things I remember I heard it in Queen Mary. She's a professor of medicine. She used to be, or she's the head of department in the dental school. She has many titles after her name. She's been awarded by the government, by the Queen, all nice awards. Because for academic like her, nice award is when she have made impact within community. But in terms of her medicine, her profession, she's on the top of her profession. She's in Queen Mary University. But one thing, if you allow me to say about you, Farida helped the community in East London to get them to appreciate, to help them understanding their problems like diabetics within Bangladeshi women, getting more from ethnic minority to come to medicine and science and technology. So she has a remarkable intervention and help for our community in the UK, and she bit rewarded. So Farida, is your floor. Tell us your perspective in the 5 minutes, and then we come back to you. Go ahead.
Okay, thank you very much, Professor Adam. What I would like to talk about today is health inequalities. But before I do that, I really feel that I have to send my condolences to all my colleagues, all the NHS doctors and nurses and our cleaners, our cooks, our fantastic technicians. All of them have died. And the Black minority ethnic group has taken the burden of the deaths in the NHS. And I think we really need to understand this. We've already had a public health inquiry. And as I said before, in April, we'll have an inquiry, but actually there'll be no answers and no way forward. And I feel that we as the community should actually take this on board and look for a way forward. And I think we could do it. But I would like to say that if we go back, and this is about what we think of as discrimination, everything that's going around. As I said, you know, this COVID is this death that haunts all of us all over the world. We're all terrified, as Chef Babaka says, but actually it's making us review quite a lot of the way we live and what we do. And what's recently happened in America, it's just boiled over the pot. But if you realize that more than 1,500 years ago, this issue about black and white was addressed with a prophet. And he said in his last sermon, a white has no superiority over a black, nor does a black have any superiority over a white. Only be judged by the piety and the good actions. And I think that that's how we need to go forward and live, because the discrimination is both ways, but it's worse on the black and minority ethnic groups. So going back to the health inequalities, what this means, this is preventable, unjust, unfair differences which occur in health outcomes. So I will talk about the UK, although I've worked, as you know, all over the world, I would say that we have the best healthcare system in the world, which is to provide care free at the point of access. So why do we have so many Black and minority ethnic deaths in COVID? Is it discriminatory? Is it just coming for this group of people? In about 2000, the government here recognized this problem, and they had clear guidance that actually it should be addressed. So that's 2000. 2006, the King's Fund year did a review and found that the group was still seriously disadvantaged. And they said the cause was deprivation, which was socioeconomic, which was racial discrimination, and it was inequality of access to healthcare. And that was in 2006. And they said this was due to the NHS, the National Health System, not addressing the issue. Where they collected data, they didn't even code it, so nobody could understand what it is. So what has this resulted in? Have we moved on, right? We 20 years away from that, but then we look, the burden of deaths in the NHS have been in this group of people. The NHS has about 1.2 million workers, of which 45% of them are Black and minority ethnic groups. But they have 62% of all deaths in the NHS. So this sort of inequality, where does it stem from? Is it socioeconomic, discrimination, or access? If you look, if I could take you on a train journey across wonderful London, as Chef Babaka says, but a very unequal London. If you go, for people from abroad, you'll know Hyde Park, and there's a tube station there called Lancaster Gate. It's just opposite to where the Knightsbridge Harrods Tube is. And you go to where my university is, which is a 20-minute, only 20-minute ride in the tube. The people in my community die 12 years before the people who live around Hyde Park die. So that has to be a real issue, right? A real issue. And for me, you know, the personal thing and the sadness is, you know, I come in the morning early, park my car, go home late at night, and I see always during the day 5, 6 hearses burying people. So this has taken a huge toll on our local community, and it's only in the last few weeks that this has been decreased. So what is it about if you're Black and you're a minority ethnic group, what is it, right? They have worse health outcomes. They have more diabetes, they have more high blood pressure, they have more strokes, and they have more heart attacks. And the reason for this is that we've got the most horrendous child poverty in this country. 7.8 million children are below the poverty line. Do you know, just in London alone, 2 million children only have 1 meal a day. And this is in a very rich country. This group are the lowest paid, and they mostly have 42% about of them have the lowest paid jobs. And they're not jobs where they get tenure, they're all short term. So of course they're going to have this, carry this burden. And then even if they get out of the poverty trap, are they going to do better? So let us look at the NHS, let us look at our universities, let us look at the medical school. In health, teaching, in the universities, in the NHS, it's all white capped. So we don't have senior people sitting around the table and driving their agenda, right? Only, so 45% of people in the NHS are BAMs, okay? Black and minority ethnic groups. only 8% of them are above grade 9. 8% in the NHS. Is this any different in the universities? No, only 5% of them sit at the top table. And that's awful. If you are within a medical or dental school, you know, you above the basic lecturer level, very few people are promoted. So you have a 76% chance of becoming an assistant professor. That's a senior lecturer in the UK, right? We only have a 14% chance if you're black. So what is it? And exactly the same in straight academia. And the people who teach our students do not represent the student population, especially in my university. It doesn't, right? We have the most multicultural national group of people. In my hospital, we talk 49 languages. We do not represent, okay, our staff who are Black and minority ethnic group. We do the cooking. We clean up after everyone comes. We do the nurses and do the changing of the sheets. We do the basic work. We, the BAM people, are the patient-facing. So they are going to be more exposed, much more than everyone else. We need to build into our system fairness and equity. We don't have overt racism, but we have tremendous unconscious bias. You know, like the Prophet said, when the chap said, is it to Bilal, you know, your mother's black? And then he said, I'm really, really sorry. What did the Prophet say back to him? It doesn't matter. Even if you didn't mean it, you said it. So here we are in the health institutions, in the universities. We have an investigation, nothing happens. Yes, I agree with Rakeen previously. We have institutional racism, and we've got to sort that out. But I think that we as a group should all work together. You know, we have to raise our profile, support each other. One of the things is actually looking government, our representatives, they're not supporting us. They're not giving our point of view. We don't work with each other. So we have to look to ourselves for our unconscious bias to make it better. And I think we can do it, actually. I think by working together, we will make a much better and fairer place to work. And I think that this has been a huge wake-up call for people who never have a voice, who were too scared to say, who are now saying, you know what, this is so important. I don't mind if I lose my job, but I think I have to speak out and say. And I think by that, people will start losing the fear. There might be 1 or 2 or 3 or 4 or 5 or 10 of us, or hundreds, but actually the groundswell now is supportive. I had a member of staff who was totally unaware of some of the really unequal things that were happening. But as I say again, I think, you know, we will get there, but it's just a shame. We've had so many deaths, okay, and so many unnecessary deaths because of not changing society. 20 years, and we look back and we haven't done anything. So I'm hoping going forward, 20 years, we'll be sitting in a different place. But if we wait for the others to do it, it will never be done. We've got to do it ourselves.
Okay, Farida, thank you so much for this quite comprehensive summarized. If you like an expert, I think your experience is tremendous. So thank you very much. You stay with us. Let me bring Dr. Sohier, particularly one of your very last point about we need to really shine and work hard to try to excel. And let us bring one of these. I'm very glad we have her. So I will bring Sohier, and I will stay with us, and I will come back to you. We will get the discussion after we see or we hear to her perspective. Now, Dr. Sohier Hamad Elneil, thank you very, very much for your time. I really appreciate it. And this is not the first time you're giving us your valuable time. We really appreciate it. But what can we do? Every time you appear on our debates, people keep asking about you. So you are a celebrity now. Now, I know, Sohier, I want to give you time quickly because you are working many times. You're coming on our debate, you're coming from the hospital. Now, Sohier is a top consultant, and that word top consultant is not my word. It's on the New Scientist in many newspapers. A couple of years ago, we have already, you can go and Google her, and her bio in the website. But they refer to her as a top consultant, UK top consultant. And in my opinion, that's a very big word, and you deserve it, Sohier, because top is a top. You talk about a country we are one of the leading country worldwide in health and in medicine and in whatever you call it. Secondly, surgery has been, I don't know, from my very little knowledge about medicine and doctors, it's more of a male discipline. Men are more surgeons than women, which I don't know. I'm not a doctor, but for her, she's a woman to become top surgeon. That's the second thing. But thirdly, also, we have seen her on BBC and others. Her own patients, they like her. They talked about her. And I think that's a remarkable thing. For me, when my students talked about me, is much better than whatever book I have published. And finally, our previous Prime Minister, what's her name? Theresa May, she awarded Sohier, that's all, even she tweeted about her. So Sohier, I'm just giving, I know you're very humble, but I really, now Sohier, she works as a consultant in University College London hospitals. And even if you may have watched in our news, it was one of the hospitals brought on TV, they call it one of the busiest A&E, accident and emergency hospital. So that A&E where Sohier worked in that hospital was one of the busiest. And that very famous documentary brought from inside that A&E on the BBC today's 2 nights is showing you the scale of the operation happening in that hospital. So Sohier, the floor is yours. We'll give you the 5 minutes, and then we'll come back and bring Farida and we carry the discussion. So give us your perspective, Sohier.
Okay, well, good evening, everybody. Thank you very much for having me there with you today. I think the issues that have arisen in the last 3 months have been life-changing really for many of us, and although there have been a lot of stipulations that have been put on everybody in the UK in particular that we have seen, the actual impact on the staff, the impact on the patients and so on in our hospital has been phenomenal. I think the first thing I would say is everybody rallied and everybody tried to do their best. The shock came to us when we started to see that Black, Asian and ethnic minority groups were actually dying at a higher rate than everybody else. And I think at the beginning, there was a discrepancy and a misunderstanding that perhaps it was just a one-off or a two-off. And then eventually it became quite clear that even in our own hospital setting, those changes were present. One of the things a lot of us tried to do was try to understand why. And we were looking into the background of this. So there were a lot of parameters that came out. And myself and a group of colleagues started to look at some of these parameters. One of them was discussing the issues of race and genetics and so on, but we also knew that the discrepancy was across the whole, all types of races, all types of genders, and yet it was still a prevalent thing within that particular overall ethnic group. We then tried to look at whether there were health disparities. And as we've just heard from Professor Farida, there definitely are health inequities and health disparities. But, you know, some of those conditions are also present in other groups as well. We then started to look at whether there were deficiencies. In particular, we were looking at whether the so-called vitamin D issue was a real problem, and whether there were other factors that we were more liable to suffer from. So all of these things started to be in the mix, and I think there was a huge amount of confusion at the beginning, but there is slightly more better thinking about it now. But one of the things we thought was that we needed to work with people to try and bring them all in. And in my theatre team, I have a large group of African nurses and Filipino nurses. And one of the things we found was a lot of our Filipino nurses were not as vocal initially. And we thought we had to bring them to the fore because they were in exactly the same situation and so on. But we started to look at the role of protection, not just in the PPE, as everybody now knows, personal protection gear, but actually environmental protection and selection and being careful and assessing people and starting to work out risk factors for people. And that sort of grew as we developed the understanding of this pandemic. There is a lot more to do. And as a surgeon, where we were all brought to a halt, so all of our normal work came to a halt. We could only do very specific emergency cases or very specific cases that we could not delay. But when we did so, we had to be completely dressed in the now very familiar outfits. But all of that made you realize actually what's important. And what I was very interested in was the response of the patients. Patients were very giving actually, and allowing us to sort of come out with ideas which they were happy to follow, and they were even very keen to listen to advice and not come to hospital unless they had to, and so on. So there was a lot of support coming in from the patients, from the community, and we were very grateful for that. However, the issue is not gone away. The impact on the staff was quite overwhelming. So many of the BAME staff struggled at the beginning because the support wasn't very clear. It is much better now, but we've had to stick together and work together so that we could then work with the infrastructure within the hospital to try and ensure that everybody got equal rights to everything. I think it was very well balanced at UCLH. It worked out pretty well in many areas. We need to now maintain that same approach. There will be others who haven't had the same the same privilege that we had, and perhaps the same group to work together. There is a lot of changes that have to be instituted. People do have to speak up. Since I was quite junior as a doctor in Cambridge, I remember being told, keep quiet, do not talk about these issues, but you have to talk about it. It's important, because if you cannot communicate and there isn't dialogue, then how will people understand there might be a problem? The changes we're seeing now have helped a lot of people come forward, and people are now starting to look into how they can address different aspects of the BAME issue, not just in the health sector, where we have a large proportion of people. I mean, Farida gave the statistics, they are very high, but also to plan for the future. And I think it's critical, the teaching and training in the future must be equitable. We need more people teaching and training, more people making it relevant for people from BAME communities to come forward, and that's across the world. You do not need to keep it so segregated to a large extent as it has been in the past. That includes going to schools, making the time to talking to the A-level students, the O-level students, making it possible, letting them see what opportunities there are, and that they will have safety and inclusion when they come in. It is very difficult for people to make decisions about jobs, and in fact, I've heard it many a time from young people saying, well, I'm not sure even if I did medicine where I would get to, and I don't want to be just X or just Y. So they have a selective, they feel they're selected into positions they don't wish to be selected in. So what I think I could say with COVID-19, which is a new world, really, I feel that there's a new world order. What's happened now to Floyd in the US and the Black Lives Matter movement has really been a wake-up call for all of us globally, that we need to work together, we need to understand each other, and it's expected of us, and actually human beings need us to do this work together. So until we do that, we will not be able to go forward, but we have to do it now, because it is, at the end of the day, it is just one world. Thank you.
Okay, Dr. Sohier, thank you very, very much. I really appreciate your point. Let me bring Professor Farida as well. Now, there's lots of questions, really. I don't think I will be, I have to see what is the best question or the important one. Now, sorry to ask you this question again, but some people, I have sent that report from the government, which is good. The government have done that survey to find, even to one expert on genetics, okay? Now, can you, I know this is a problem, we keep getting criticized, academic, you speak too long, you try to prove to me with science, you are most top scientist. Do Black people genetically, I know you have explained it, I know you tried your best, do we have any scientific evidence now to say that with the Black people, I know the vitamin D and the skin and all that, do we now as the Black people, can we say we are more susceptible to this COVID-19? I know it could be, we could easily say no, because still there is no evidence. But so far, what do you learn, both of you? What are we susceptible to COVID-19 more? I know the issues Farida mentioned earlier in America, they were discussed, and they all to do with the social science, poverty, and so on. Black people are living in poor areas, therefore they are likely to be obese, having diabetics, and all that stuff. So which will make them vulnerable to the COVID-19. Nothing to do with their color, but indirectly. But directly, genetically, if there is anything, we are more susceptible to this COVID. Any one of you can start.
Farida.
Okay, so yeah. I would say there is nothing genetically, right? I do think that we have, so I deal with rare diseases, and there are a population within that within my patients who have a much greater inflammatory response when they see viruses, right? And so you can see people getting more disease. But what you're asking is, are they more susceptible to it? I would say within the health system that when it came to people started saying, oh my goodness, there's 5 senior doctors who died, and they're all Black and minority ethnic groups, and then they concentrated on the doctors, okay, and they didn't look at the other groups. And the problem was that, as was being said, the problem was also the environment. And when it started, all the people who went to a certain group and the others didn't have such good. Okay, then they had PPE. But I still, you still see a patient, a room has to be deep cleaned.
Yeah.
The chap comes around to clean the room. Actually, he's got no PPE. He doesn't even have a mask. So, and that chap doesn't know. So we now have the government saying you have to risk assess your staff. To be quite honest, if I risk assess my staff, we wouldn't have a service for my particular specialty, because I have less than 3% of them not being Black and minority ethnic groups. The people that keep the hospitals running, they're invisible. They don't have a voice. They are too scared. They might be on limited contracts. You don't speak out. You need to keep your family fed. But if people like us, okay, the two of us here, to help encourage people or actually be their voice. I'm really passionate about that, because I think this group is hidden and this group is carrying a burden. More nurses have died than doctors. And as you say, you go to any of the ITUs, they're full of the nurses from the Philippines, and in the front line. So exposure more than anything else. Put at your risk assessment, you're more at risk, not because of your genetics, you're more at risk of where you are.
Okay, because we don't want to end up next time someone will write an article saying Black people are causing us more, they're costing because they have COVID. Okay, Sohier.
So I would agree. I don't think there is a genetic factor at all. And so when we looked at our hospital statistics and other colleagues' hospital statistics, it's exactly what Farida has said. And I remember being on call the weekend before we had the government lockdown, and we were just starting to understand we needed masks and gloves. So even the doctors were not as up to speed. So many of us saw patients who then turned out to be COVID positive, where we didn't have all the kit or the gear, etc. We all tried to. So education is key. Education for everybody is key. And that's one of the things that we didn't really understand and didn't get sorted. Having access to the appropriate coverings, absolutely the same. And I agree with Farida. One of the things that used to worry me was the cleaner who went into certain COVID positive environments, the lady who was delivering the cups of tea and coffee, the woman who was bringing, the porter was bringing the stocks to the place. They all didn't have any protection. And eventually they realized that they too, but there was a ridicule associated with it as well at the beginning. And it's still, there's a little bit of that, if you wear a mask and wearing gloves, that somehow you're not, strong enough to fight the virus or whatever. But now I think people understand quite clearly that you have to be protected, and it's not the inherent just protection, but the external protection and the environmental protection. If we clean everything better, we put everything in the right place, we have strict rules of who goes in and who goes where, etc., then it will be better for everybody. So coming back to your question, no, I don't think there's a genetic bias. I just think there's an environmental impact, and then an inherent conditions that we all have. I'm sure if we eventually look at all the stats, you'll find there's equality. Everybody who has diabetes had the same risk. Everybody who is obese had the same risk. I don't think there's a genetic basis.
Okay. The second question is based from Janet Snow, our very senior investigator from Brighton, but I will add some politics to it because Boris Johnson himself talked about it. What Janet said, it is, I hope she said, she put that to another panel on the wake, but it relates to you guys both. She said now the whole world or the whole UK realize the importance of doctors in all NHS staff. We all now we can see, we have seen it by our eyes. So every Thursday people clap for the NHS. The Prime Minister said that. He said how much you guys, the cleaners, the nurses, how much really you have saved people's life, which is more important to anyone than anything else. Now, what Janet said, or her question, which I asked her to record it, but she didn't. What Janet said, she said, I hope after we go, or post-COVID, the government will appreciate those who were not very highly privileged in their ranking or in their prestige, or how do we treat them? You are consultants, you are professors, the society treat you at the highest level. They regard you at the highest level. I know you are very humble, but you are in the highest level of the society. But we have the cleaners, the nurses. We as a society did not treat them as they should have been. And the Prime Minister appreciates that. So my question to both of you, Janet said, to what extent are you confident after all these lessons, and thanks God the infection is getting less now, and we should get through it in the next few months. To what extent you guys leading these institutions, to what extent do you think the society and the government will rethink about how to treat these people, giving them more salary, more and more and more? And don't forget, these nurses and the cleaners were part of the discussion when we are about to leave the European Union, because our British graduates or youngest, most of them are immigrants. These have been a very high political charge discussion. If we get out of the EU, we're not going to get clean and so on. So I know it's a complicated question, but to what extent you are confident after the lessons we have learned? The Prime Minister himself said that. Are you confident how we're going to give back respect and regard to those who are not getting it, like cleaners and so on, particularly nurses? And secondly, to what extent do you think, if we take we come back to the same Black ethnic minority, to what extent do you think there will be a regard and high respect for Black, particularly now we have seen this whole report is being triggered because consultants like you from Black and ethnic minorities, they lost their life. So for the first one is quite generic, but the second part, regard and respect for those Black in general, not necessarily consultants, in terms of their role in the community.
So, I mean, I think the answer almost is quite simple, actually. I think if you are in a position to be able to speak with them and for them, then it's absolutely your duty to do so. You cannot keep quiet. So I've been very fortunate, although I don't do obstetrics and I haven't done for 16 years, but my I have a fantastic team of colleague midwives who had exactly that approach. They came and we had a chat and a discussion, and we are now working together. Similarly with the nursing teams and the ODPs and so on, and the porters and the administrative staff. And, you know, you work with the entire team. And actually, it is your duty to speak out. It is very difficult. And I agree that sometimes, and as Farida will tell you, all of us had a blanket sort of ban not to speak to media, not to speak to anybody, but actually where it matters about, you know, well-being and staff and so on, eventually that will change. So that's number one. If you're in a position to be able to make a difference, you must make a difference. You must stand up and empower others to do the same. You don't have to do it yourself. Everybody else will stand up with you. So that's the first thing. And I think the difference is that I think people have suddenly realized the huge volume and sheer numbers of staff within the health service that are providing care at any level. It doesn't matter what level you're at. There will be some who will think, well, we can manage on our own. But I think what this crisis has shown quite clearly is this has got nothing to do with the immigration rules per se, because you're going to need everybody with you on that step. The second thing is, or the third thing, this virus is not going to be going away anytime soon. So you have to start putting things in place now to ensure your health structure and infrastructure remains on its feet. Already, every time we think we can go forward, there is something that pulls us back a little bit. Every single time we thought we could start surgery in the next month or two, we can see that it can't happen, not back to the levels we had in February or even before that. So you need people right now where they are to do the best job that they can do. And that from there, things will grow. And I think things will change.
And before I go to Farida, Sohier, because I have seen that question being asked to a consultant in the BBC. When you wake in the morning going to the hospital, do you fear for yourself because you are in the far front of this? Do you really get that some inner side? I might catch anything, I hope not, but did you get that feeling inside you?
I would say in the first months, every time you went anywhere near a health facility, you had immense fear. And then gradually you got used to it. It became the new normal, not that it was acceptable. Okay. But what was fascinating for me, and this is what one of the things this is why I said about people coming together, I'd walk in and my junior doctor would say to me, Miss Elneil, you need this kind of a mask. You know, my nurse would say, I'm just going up the corridor, I'm going to get you that apron. You know, don't worry, I've got you something. Everybody did pull together at every single level, from the the security guard at the door of the hospital, all the way to your theatre team and so on. There was a humanity that came back that I probably haven't seen in England since I was a child. So it's an amazing change in behaviour.
Excellent. Thank you very much, Farida.
Okay, so I think the question was, will this change what the government's doing? I think one of the things that I was very worried about was when we had the deaths, with their families of the people who died, because most of them were immigrants, would the families be allowed to stay? Now, I'm very thankful and pleased that the government had made that possible. But actually, it was a real push for them to make it possible for people other than the doctors and nurses. So that's gone forward, and we're very thankful for that. But I'm very, very disappointed because, you know, if you're an immigrant and you work for the NHS, you still have to pay NHS fees, which is $400 per person in any household. Okay, so you've got 2 adults, 2 children, You know, that's a lot of money when you don't earn a lot of money. You might earn 9,000 a year, and you know, 1,200 is taken out of your pocket, and it's going up to 620. And Boris Johnson himself said no. Okay, we as a country can't afford it. Well, what I'm really hopeful for is that over the last 10 years, we've all seen the NHS being absolutely starved of money. All right. And I'm hopeful that now everyone can see this is actually a fantastic service. You know, I don't think anyone, if they were admitted with COVID, would get as good treatment as they have done here. You know, and everyone, all the doctors, nurses, everyone put themselves to the front. So I hope the government will look and say, we don't want a privatized system. We do want to NHS and actually invest in them. And I think Sohier has made a very, very important point. If you're in a position where you can have a voice, then you've got to use that voice for the people who cannot use the voice for lots and lots of reasons. And I can tell you that once a month I have a closed mentoring. Anyone from all over the country can come and see me. And it's heartbreaking. You know, I just listen to people. I sit in a dark room with them. I listen to them talking, and then I will try and give them strategies to work within the system. We have to have more equity, you know, and we have to have more visibility. Yeah. And we have to be seen to that we do give a really good offer. All right. And the other thing is, you know, about going out in the morning and going to work. So for me, it's been quite difficult. I haven't had a day off since we started. But it's not, when I go out of the house in the morning, I ask for protection for my husband and my family, because that's the thing I worry about most, rather than, because when you go there, Sohier will tell you, you know, you enter a system and you do the work in front of you and nothing else but what needs to be done is in place. Now, I would say one thing, Professor Adam, that before this, there was a webinar, and I was asked by somebody from the BBC, you know, what do you think the outcome would be? I saw all of this 20 years ago. We see it again and again, and everyone says, you know, we're hopeful and everything's going to change, and nothing changes. But actually, we waited for it to change. And I think the difference with COVID is that people will push and not be sitting around waiting for the change. People are going to begin to demand the change and to demand to have a voice.
Okay, I thank you. I know if I continue to talk, I will not stop with you. Both of you are very fantastic. But one last, I'll give you 1 minute each, if I can. I know it's very difficult. 2 messages. One, for the UK, for us here in the UK, particularly now the Prime Minister is wanting us to go out, whatever the way you can describe it. Now, people are very scared. People are not confident in our own Prime Minister advice, because the proof is the school. Many people have not sent their kids to school. That means they are not confident the school is safe for the kids. Now, what can you both top expert here in MENA? I know I don't want to put you in charge of a political discussion, but I'm not asking you to give us what you think of the advice, but what can you advise us as normal citizens, black or white, whatever our color or ethnicity, doesn't matter. Not what is you think of we can go or not, or is safe or not safe, but what can you advise us to do? I know we've been told, wash your hand, take the game, put the mask legally, all this we know. If there's anything else you have. Second message, now is declining in us, according to the government. I don't know, they said it's declining, the infection is going down, but unfortunately, other countries are having the peak now. Like in Africa, is killing more than, is increasing. Now we are in decreasing. What is your advice? Don't tell them about wash, because I have seen many webinars every night telling them to wash, telling them to avoid, telling them, this is, everyone knows it now. Don't mix, but they are mixing. Don't do this, they are doing it. If there's anything else, a magic message you can send globally. So 2 messages here, and one globally, but make them in 1 minute if you can. Swear.
That's a really big ask, Professor Allah.
Yeah, I don't want to use the spotlight. What can you advise us? I am here in London. I know what they said. I know what the government said. I know my kids. I take the decision. But what else can you advise me? Can you reassure me to get my kids to school?
I think the major problem is fear. We have all gotten used to being in our own space, and for the first time at the beginning, you might recall most people didn't want to be in their own space. They wanted to be out, but now everybody's, my space is the safest space. I think common sense, honestly, I think it has to be individualized. The advice is, yes, things are better, etc., but a lot of people are not ready for that advice. Some are, but some are not. And I think there has to be a gentle realignment into society. You cannot force people to take a step they don't wish to take. So you have to gently wait for things to happen. I can see that a lot of people are waiting for the R number to improve and to be better and so on. But I think in the meantime, there is a lot of fear. There's a lot of anxiety. I don't think you should beat yourself up about it. I think you should very gently discuss it and spend a bit of time thinking it through and talking to people that matter to you and you feel confident in. I don't think there is a one-size-fits-all in this. I think you do have to manage it independently, individually.
And so I don't think in Africa, other places, they're still struggling now. What can you advise them?
I'm working with colleagues in Sudan and in Nigeria and so on. And one of the things has been the messaging has been there, but the lack of things like PPE, the lack of understanding and education. Education is key. It has to go out. And as you know, in Africa, it's not the television, it's the radio in a lot of places. We need to improve messaging on radio, messaging on television, those who have smartphones, etc. That's number one. But number two, it's also making people realize that this is not a one-off thing. I think that's the one thing I would like people to understand. This is not a one-off. This is a problem for 3 months, 6 months, a year. This is a problem that we could have for the rest of our life and existence on this planet. People need to get used to that whole concept. So I would drive that home, educate the people, really make an effort, get that information out there. Some very basic stuff, but education is key. Okay,
Farida, your last word on these two.
Yeah, I totally agree with everything that's been said. I think education, so if we take Africa, where I'm working as well, it is no point working at a governmental level, it's working with community levels. Yeah. And I think that's really important. And we've done things like take a lot of World WHO documents and make it into a 100-page document, into 10-page, lots of pictures, send it out so that when there's clinics, they can pull a sheet out and paste it up. So easy messaging, education, use both TV, smartphones to do that. And very, very important is, if you don't have food to eat, you have to go out to work and you can't stay at home. So lockdown has been absolutely awful, and it has to have been policed in a lot of African countries, but they can't do it for a very long time. So, but I think if you look at the Ebola and how the Nigerians managed that, so they were long before anyone else. What they did was find, trace, isolate, trace, isolate. And they only had 5 deaths and I think 21 cases. We all started much too late doing that. And I think a lot of African countries now have started a bit earlier than us. And hopefully, their figures won't be as amazing. I know in Sudan it's been terrible, but if you look in Somalia, they had very early start. The other thing is that I think African leaders are now finding out that actually they can't go to Europe for their treatment. So they're locking out. Actually, they've got to take that money and invest in hospitals. So in Somalia, they suddenly found that, several hospitals were built. the other thing is you can't depend on Europe and the world giving you money, because they will lend you money from the World Bank and you will then pay it off again forever. So if you look in Liberia, what's happening, the local community there had said, you know what, this is my hotel, make it into a hospital. So I think what's happening in Africa, people are beginning to be self-reliant, and with that self-reliance and education will come control. And it's not going away. The world is going to change. What are we doing here? I think people are so confused, actually, because there have been so many mixed messages. So they can't even have make their own decision, you know, because everyone is fearful, everyone is anxious. How do you make a decision? How do you be your normal, sensible, reliable self when you are stuck in this conundrum of what to do? And I totally agree. I think in the end, everyone is having to make the decision for themselves. And that's really important, you know, that, you know, you're going to wash your hands before you go out, you're going to wash your hands before you come in. It's amazing in Zimbabwe, in a community level, how quickly. And of course, I said to my sister, you know, they need to wash their hands. She said, Farida, how can I wash their hands? I've got one borehole for 6,000 people. But then, so they have been wonderful in having alternative strategies. And I think that's the thing, that self-reliance. I mean, I think, yeah, I have a huge number of people who are shielding, which is a higher level of isolating. And you know, we never knew. And suddenly the government came out and said, okay, you can go out and meet people. So it's very difficult from a health perspective for us to maintain messaging and keep the confidence with patients, actually. And so there's this vulnerable group, okay, and there's the rest of the population. And I think the management around that needs to be much more sensible. And actually, as Sohier is saying, you know your patients, you know what they should be doing, okay? You're much better off giving advice. Yeah. And people like you, Prof. Alan, you know, you are sensible enough to take advice. But when you've got a 15-year-old young boy, he isn't. But so there needs to be a bit more education around it. And I think everyone thinks, you know, it's all going down, but it's not going to go away. And I'm just saying to people, you know, I might be mad, but actually just make plans for the autumn.
Okay. Okay. Now, now, thank you very, very much. This came, and I think it came very well. We're all very proud of you, Sohier and Professor Farida. Now, many people have approached me in the last time we organized something about Corona, and I said, really, we have done enough. And there is not much new we're going to bring, because Farida, I think at least you came to us 3-4 times. And I know I have seen many webinars you have done, the same for Sohier. And in one occasion, I said to a government official, I said to him, the one we did in Sudan, it got Sohier, it got Muiz, the top professor in genetics and whatever, and we got a head of, director of, what's her name, Mayada, head of public health in Birmingham. We got a virologist. I said to them, there is no more people we can bring. These are the top people here. But why I'm mentioning this, like now Najwa said, we are very, very proud. I would like to make this call, and I can assure you I will get this, because these videos, I'm sure Mervyn will go and do a good job on these videos. We will make sure this video, particularly this one, all of them, they will be cut, the education and all of them. We will get it to the mayor of London, because I remember when I was just a senior lecturer a long time ago in East London, 2000, my senior, Professor Sonny Nawanko, originally a Nigerian, he's a well-respected professor. He proposed to King Livingstone at that time. We had at that time, 20 years ago, lots of black kids are not going to school. They are dropped. They're having crime. So the proposal of that Nigerian professor is that we take role models who are black and go to the community where these kids are dropping school and talk to them. And I remember Trevor McDonald, these big names. So it's just a normal talk. So I would, and I think King Livingstone at that time, he supported that program. So they took black, big names like you guys. So two things, I would recommend this, and I think I really hope those from the government or from the assembly or London Assembly or the mayor office, why we send this video, they really go back and do things like this. So we move or we go, we stop people like you, and they go to the grassroots where our black and ethnic minority are there, are dropped. They are not there, they're fighting crimes. And we will just simply not talk to them about medicine, but you talk to them about, inspire them. You are a top consultant, you and so on. And secondly, in Urogynaecology, I remember I have watched this, I was in one of the conferences, I can't remember, a black girl from a lecturer, assistant professor from Urogynaecology, she said, part of Urogynaecology to attract black and ethnic minority to come and study science and technology, they go to school and play with them, showing them the physics and important. So you have done your part. I know you're working very hard, but I really send this message. One of these conclusions of this panel is to attract more black and ethnic minority to subjects like physics, medicine, and so on, which are not really attracted. And then thank you very, very much. I really appreciate your time, and you're definitely one of the best in this country. I wish you all the best. Thank you very much. Yeah, you're saying that. What do you want to say? Go ahead.
I just want to say, at Queen Mary, we have a program, and about 10 years ago, none of the local children were getting into university. And by bringing them into the building where I am and running courses for them and groups, we now have about 60% of them being able to get into Russell Group universities. So I think it's really important that that's done in a lot of other places.
Thank you very, very much. I wish you all the best and take care. And I really appreciate your time. And thank you again for every time you're coming in. Thank you very much, and enjoy the rest of your evening. If you're not going back to the hospital, thank you very much. Thank you. Thank you very much.
Okay, great.
So please remember, if we all help and do a little bit, it will make a big difference.